We would encourage any child who's not performing to some sort of age or grade base expected is a number one factor. Those kids generally, there's a higher prevalence of what we call oculomotor skill issues in that group. So that's convergence focusing, eye teaming. And so you want to make sure that there are no vision problems that might mimic a learning difficulty. And like we say to parents, if we get someone who's struggling with certain aspects of their learning, and we're able to manage the vision problem, and all of a sudden they take off, well, we know they don't have a learning problem. They just had a vision problem that was getting in the way. And so it becomes part of that troubleshooting process. If we find a vision problem and they get a little hit in improvement, but not as much as they would like to see, then it tells us this is a child with two things, a vision problem and potentially a learning problem. And if you're going down the path of having to get your child assessed for learning difficulties or attention disorders, then quite often the practitioners doing that want to know whether how well they're seeing. Have they had a hearing test? Have they had a vision test as a part of that differential diagnosis, ruling out things that might mimic it. I also explain to parents too that we want to manage the vision problem so that those kids have to knuckle down and end up doing a lot more remediation in one form or another, which is highly visually demanding. And so we want to make sure that they're well equipped for the remediation process as well. Some of your other softer signs, if you're talking young kids, before school, getting close to the TV, turning their head, closing one eye, maybe being overly sensitive to bright light, they can be sort of signs that there's an underlying vision problem. Not engaging in what we call pre-literate activities, so things like just looking through books. Do they avoid drawing? Sort of show a disinterest in looking at the page even when they're being read to. I mean, these can all be signs that vision needs to be looked at.
So even writing, even like struggling with writing, could be an indicator, couldn't it?
Absolutely. So any of those sort of lack of progress or lack of interest in engaging in learning activities is a big signal to make sure that you get a thorough full vision assessment done.